Venous blood gas as a replacement for arterial blood gas in emergency settings. In emergency medical settings, the assessment of blood gases is crucial for managing patients with acute respiratory or metabolic conditions. Traditionally, arterial blood gas, ABG, analysis has been the standard for evaluating oxygenation, ventilation, and acid-base status. However, the use of venous blood gas, VBG, as an alternative to ABG is gaining recognition for its ease of collection, reduced patient discomfort, and numerous benefits. This video explores the comparison between VBG and ABG, highlighting the advantages of VBG as a replacement for ABG in emergency settings. Comparison between VBG and ABG. ABG has long been considered the gold standard for assessing blood gases due to its accuracy in measuring various parameters. While ABG provides precise data on pH, PCO2, and HCO3 levels, it is invasive and can be very painful for patients. On the other hand, VBG, obtained from peripheral veins, offers a less invasive and more comfortable alternative. Recent studies have shown that VBG can provide comparable results to ABG in assessing pH, HCO3, PCO2, lactate, electrolytes, and base excess in many clinical scenarios. However, VBG may not be as accurate as ABG in severe shock or cardiac arrest situations. Benefits and advantages of VBG. The use of VBG in emergency settings offers several benefits and advantages over ABG. VBG is easier to obtain, less painful for patients, and carries a lower risk of complications such as vascular or nerve injury. It provides valuable information on acid-base status, electrolyte levels, and lactate, making it a useful tool for screening and monitoring critically ill patients. In hypotensive patients, VBG has shown a strong correlation and agreement with ABG results, making it a viable alternative for assessing blood gases in this population. Additionally, VBG analysis is a non-invasive procedure, increasing its accessibility in the emergency department. Clinical applications of VBG. VBG is a reliable tool for assessing respiratory and metabolic conditions in the emergency department. It can correctly diagnose respiratory acidosis, metabolic acidosis, diabetic ketoacidosis, and renal failure, making it a useful alternative to ABG analysis. In patients with diabetic ketoacidosis, venous pH and PCO2 levels reasonably correlate with ABG values. In COPD patients, there is no significant difference between arterial and venous CO2 tensions, and the two are closely correlated. The venous pH is generally 0.03 lower than the arterial pH, and venous PCO2 is about 6 mm of mercury higher than arterial PCO2, but the correlation between venous and arterial PCO2 is not consistent, particularly in severe shock or hypotension. Limitations of VBG. While VBG is a valuable alternative to ABG in many cases, it has limitations that should be considered. In conditions of severe hemodynamic compromise, such as profound shock and cardiac arrest, VBG analysis of lactate and pH may be less accurate compared to ABG. VBG also correlates less accurately with ABG in measuring PCO2 in patients with severe shock and hypercapnia. Lastly, VBG analyses are not able to assess oxygenation. Pulse oximetry is a non-invasive alternative for arterial blood gas sampling. Take-home message. In conclusion, VBG analysis presents a promising alternative to ABG analysis in emergency settings. However, ABG may still be necessary to accurately determine PCO2 in severe shock and hypercapnia. Pulse oximetry is a non-invasive alternative for ABG to assess oxygenation.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.